Good day, and welcome to Zoyols News. I'm Michael Reed. Health officials are urging people along the Gulf Coast to take extra precautions after a rise in serious bacterial infections linked to coastal waters. With warm temperatures creating conditions that can help certain bacteria thrive, beachgoers are being advised to stay alert and take simple steps to reduce their risk. I'm Michael Reed. The news begins now. Health officials are urging people to take symptoms seriously after exposure to coastal or brackish water, particularly during the warmer months when certain bacteria can multiply more quickly. People who develop a wound after coming into contact with seawater or brackish water are being advised to monitor the area closely. Warning signs can include increasing redness, swelling, pain, warmth, or unusual changes in the color of the skin. If any of these symptoms appear, health professionals recommend seeking medical attention as soon as possible. Patients should also tell their healthcare provider that the wound was exposed to seawater or brackish water. That information can help doctors consider possible bacterial infections and determine the appropriate treatment. One of the main concerns is Vibrio bacteria, which naturally occur in coastal waters, including seawater and areas where fresh water mixes with salt water. These conditions are common in estuaries, lagoons, and other brackish environments. Health officials say infections are reported more frequently between May and October, particularly along the Gulf Coast. Warmer water temperatures can create favorable conditions for the bacteria to grow and spread. Among the different types of Vibrio bacteria, Vibrio vulnificus is considered one of the most serious. In some cases, an infection can progress quickly, especially when it enters the body through an open wound. People with open cuts or wounds are therefore advised to avoid contact with warm seawater or brackish water when possible. Taking basic precautions and seeking medical care quickly when concerning symptoms appear can help reduce the risk of serious complications. Health officials are also warning that Vibrio vulnificus infections can become extremely serious in a short period of time. Data from the U.S. Centers for Disease Control and Prevention indicates that the infection can be fatal in as many as 1 out of every 5 cases. Florida has already reported 14 cases and 2 deaths so far this year, according to available health data. Officials have also noted that infection numbers can increase during years when hurricanes and tropical storms affect the region, as storms can alter coastal water conditions and move bacteria into areas where people may come into contact with contaminated water. There are 2 main ways people can become infected. One is through eating raw or undercooked shellfish, particularly oysters that may contain the bacteria. The other is through an open wound or even a small break in the skin that comes into contact with seawater or brackish water where Vibrio bacteria are present. Because the bacteria can enter through very small cuts that people may not even notice, health experts advise people to be especially careful when swimming or wading in warm coastal waters. Anyone who develops unusual symptoms after exposure should seek medical attention promptly and tell healthcare providers about the possible water or seafood exposure. The warning is especially important during the warmer months, when coastal water temperatures can create conditions that allow Vibrio bacteria to multiply more rapidly. Doctors say severe cases are more common in older adults and people with weakened immune systems or conditions like liver disease and diabetes. Scientists link climate change to Vibrio spreading and increasing, with a 2023 study finding the northernmost cases shifting about 30 miles per year. The bacteria can enter through unhealed cuts, piercings, tattoos, or surgical incisions, so wash wounds well with soap and clean running water after contact with coastal waters or raw seafood. Health officials are urging people to seek medical attention quickly if they develop symptoms after possible exposure to Vibrio bacteria. Early warning signs can include fever, chills, increasing pain, redness, or warmth around an affected area. In more serious cases, the skin may become darker, develop blisters, or show other signs of a rapidly worsening infection. Oysters remain a major concern because contaminated shellfish can look, smell, and taste normal. There is no reliable way to tell whether an oyster contains harmful bacteria simply by examining it. For that reason, health experts recommend taking extra care when handling raw shellfish and avoiding raw or undercooked oysters. People should wash their hands thoroughly with soap and water after handling raw shellfish. Those at higher risk of serious infection may also consider using protective gloves when preparing or handling seafood. Similar precautions apply to other shellfish, including clams and mussels. Before cooking, people should check the shells and discard any that are already open and do not close when handled. Shellfish should then be cooked thoroughly by boiling, steaming, or using another safe cooking method. The overall message from health officials is simple: take coastal water and raw shellfish exposure seriously, pay attention to unusual symptoms, and seek medical care promptly if signs of infection appear. Follow official shellfish cooking instructions to reduce the risk of Vibrio and other foodborne illness. That is the latest on the health warning along the Gulf Coast as officials respond to a rise in potentially deadly bacterial infections. Authorities are urging residents and visitors to take precautions, especially when swimming in warm coastal waters or when they have open wounds. As health agencies continue monitoring cases, staying informed and following local safety guidance remain important. For more breaking news and in-depth coverage, stay with Zoyols News. I'm Michael Reed. Thanks for watching.